You know, in a field like nursing, a single decision can literally change a person's life. So, how do we make sure those decisions are solid, that they're based on more than just a gut feeling or, well, this is how we've always done it? How do we find out what really works? Well, let's get into it. And that's the big question, isn't it? This is what pushes the entire profession forward. How do we make sure that every single thing we do is backed up by the best possible proof, not just habit or old traditions? That's exactly what we're going to unpack. So to really answer that, we've got to look at how nursing has grown up, so to speak. It's been this incredible journey from a practice that was all about intuition to a real, hard-hitting scientific discipline. Think about it. For the longest time, nursing was a craft, right? Passed down from one person to another. And don't get me wrong, that hands-on experience is absolutely vital. But today's healthcare world, it demands more. It demands a systematic way to prove that what we're doing is actually making a real, measurable difference. And this is where nursing research comes into the picture. Now, this isn't just about doing a few studies here and there. It's a formal, rigorous scientific process. And the goal is pretty straightforward, but wow, is it powerful. To build this rock-solid foundation of trustworthy evidence that guides everything a nurse does. So what's the engine that drives all this research? Well, it's a concept you probably ran into way back in middle school science class, the scientific method. It's still the gold standard, the best tool we have for getting reliable knowledge and testing our ideas to see if they hold up. All right, so let's do a quick refresher on that ideal blueprint. You know, the classic step-by-step process that's really the backbone of any scientific discovery. It all kicks off with something simple, just observing. Maybe a nurse notices that patients in rooms with more sunlight seem to be in better spirits. From that little observation, you check what's already known. Make an educated guess, a hypothesis, and then design a way to test it. You'd collect your data, see what it says, and finally, share what you found. It's a nice, neat, logical path. But here's the thing. In the real world, it's rarely a straight line. It's much more like a continuous loop. The answer you get from one study just sparks a brand new, more interesting question. It's a constant cycle of asking, testing, and getting a little bit smarter each time. Okay, that all sounds great in a perfect world, right? But here's where it gets, well, complicated. What happens when that clean, perfect blueprint from the science lab runs headfirst into the messy, chaotic, and wonderful reality of human beings? This quote just nails it. It gets right to the heart of the problem. People aren't just chemicals in a beaker. We have feelings, beliefs, messy relationships. You just can't control for all that stuff in a sterile lab environment. And here are some of those major roadblocks. I mean, first and foremost, you have ethical rules. You can't just withhold a treatment that might help someone just so you can have a control group. And then you've got all the human factors. Our feelings and beliefs change things. Plus, how in the world do you put a hard number on something like pain or anxiety or caring? You can't. So here's the bottom line. That super rigid, strictly controlled experiment hits a real-world wall. It's powerful, for sure, but it's often impossible, or just plain wrong, to use in nursing. You simply can't put patients in a test tube. So what do? Throw science out the window? No way, not at all. Nursing adapts it. It creates a new approach that is still scientific and rigorous, but also realistic. Let's check out how. The huge difference is this. The strict scientific method is usually about a researcher actively going in and changing something, manipulating a variable to see what happens. But the nursing research process, well, it has a much broader scope. A lot of the time, it's about carefully observing what's happening naturally. This means that nursing research has a much bigger toolkit. It's not just about experiments. It uses all kinds of methods, like observational studies, to understand these incredibly complex human experiences as they happen, right there in the real world. But now, this is really important. Adapted and flexible do not mean sloppy. The nursing research process is still incredibly systematic and rigorous. Every single piece of the puzzle, from how you pick your participants to how you analyze the data, is meticulously planned out. So why go through all this trouble? Why work so hard to adapt the scientific method in this way? Because at the end of the day, the result of all this careful, hard work has a massive impact on patients. It all leads to this right here, evidence-based practice. This is the whole ballgame. The best way to think about it is like a three-legged stool. You've got one leg that's the best research evidence we have. The second leg is the nurse's own clinical experience and wisdom. And that third leg, that's what the patient wants, their own values and preferences. And that's really the key takeaway. This careful balancing act is what allows nursing to be both an art and a science. It makes sure that the care you get isn't just kind and compassionate, but that it's also the most effective care possible, backed by real, solid, scientific proof. It's how we know we're doing what works.
Which leaves us with a final thought to chew on. This constant push and pull between the hard data of science and the complicated reality of being human, it isn't just a problem to be solved. It's the very engine that's going to keep pushing patient care forward, making it better and better for all of us.